Now today we have dissected the gluteal region. This is the muscle which is present on the superficial surface, that is after removal you are seeing this gluteus maximus muscle. When you remove this gluteus maximus muscle, below that here is the gluteus medius, gluteus minimus muscle. Now these are the fibers of that only that will reflect. Now here this is the piriformis muscle. Just below the piriformis muscle here is the sciatic nerve, which will come out through the greater sciatic foramen. Now this is the greater trochanter and this is the ischial tuberosity. From this ischial tuberosity there are the origin of the hamstring muscles. Now the hamstring muscles will take origin from the ischial tuberosity and will go onto the posterior surface of the thigh. So this is the biceps femoris, which will go onto the lateral side. This is the semitendinosus and this is the semimembranosus. So these three muscles will take origin from the ischial tuberosity and they will constitute the hamstring muscles of the thigh. Now they are supplied by the tibial part of the sciatic nerve. Now they will go below and form the boundaries of the popliteal fossa. The boundary, that is the superolateral boundary of the popliteal fossa, is formed by the biceps femoris muscle. The superomedial boundary is formed by the semitendinosus and semimembranosus. So this is the tendinosus muscle and this is membranosus muscle. Now the popliteal fossa is a diamond shape. So there are the superomedial, superolateral boundaries and infero-medial and infero-lateral boundaries. The infero-medial boundary is formed by the medial head of the gastrocnemius and superolateral is formed by the lateral head of the gastrocnemius. Now in the contents of the popliteal fossa, this is the sciatic nerve which will divide into two components. This is the tibial component and this is the common peroneal component. Now at the popliteal fossa, the common peroneal will again bifurcate into two, that is the anterior tibial nerve and this is the superficial peroneal nerve. So this anterior deep peroneal nerve will go onto the anterior side of the leg to supply the muscles of the anterior compartment of the leg, and the superficial peroneal nerve will go and supply onto the lateral surface of the leg. Now in the contents of the popliteal fossa, here you are seeing this is the popliteal nerve, then this is the popliteal artery and this is the popliteal vein. Now there are again popliteal lymph nodes also and popliteal adipose tissue, that is the fat is present. So this is the popliteal fossa which is diamond shaped.